Good afternoon, everyone, and thank you for joining us for our first ever virtual Storybook Ball spring event. My name is Andrea Rosen, and I am honored to be co-chairing the Storybook Ball again this year. Wherever you are tuning in, we hope this finds you and your loved ones safe and healthy during these very challenging times. To begin, just a few housekeeping reminders. This is a listen-only event. No microphone or video capabilities are needed to participate. At any point during the webinar, you are able to ask questions, anonymously if preferred, through the Q&A feature located in this webinar. Please keep questions as brief as possible. This event will be recorded, and a shareable link will be provided to you after the event. Like many of you, I have been lucky to be able to work from home and been busy homeschooling our son and watching the news daily. It's been wonderful to receive important COVID-19 updates from MGH. And today, we look forward to hearing from those on the front line of this health crisis and all that the MGHfC faculty and staff have been doing for both children and adults, as well as what the future looks like. And now I'd like to introduce Fiona Benenson, our co-chair for this year's Storybook Ball.
Thanks, Andrea. Hello, everyone. I'm Fiona Benenson. I'm honored to be co-chairing Storybook Ball this year. It has been a pleasure to work with Andrea Rosen. And while we wish we were celebrating the kickoff of the 21st Annual Storybook Ball in person at the Boston Harbor Hotel as previously planned, we are happy to be joined together virtually in this setting to celebrate our MassGeneral Hospital for Children community, of which you are all a great part. We have a great program lined up for you this afternoon. We will hear from MGHfC leadership, as well as MGHfC Advisory Board Member and Event Industry Expert, Bryan Rafanelli. We are very pleased, as of this afternoon, that we have raised $255,000 towards our goal. Thanks to all of you who have pledged so far. And for everyone, please keep an eye out for sponsorship packets, which will be mailed to you shortly. If you haven't pledged yet, please do so. As we all know, MGHfC is counting on us now more than ever. And again, I just want to echo Andrea and say thank you to everyone for tuning in. We are all juggling so many things, and it's really appreciated to have everyone on the line today. So thank you. It is my great pleasure now to turn over the program to Dr. Allan Goldstein, Surgeon-in-Chief at MGHfC. Dr. Goldstein?
Thanks, Fiona. First, I want to express my thanks to all of you for your participation and support during this time. It's obviously a very trying time, and there's no aspect of life that this virus hasn't touched. And the front lines at MGH and MGHfC are obviously no exception. I also want to take a moment to acknowledge the tireless efforts of the entire MGH and MGHfC team. The dedication, compassion, kindness, and skill of all of our staff has been remarkable and inspirational. As you all know, Mass General has been a leader in this crisis. Dr. Slavin, Dr. Rochelle Walensky, the Chief of Infectious Disease, and others have been interviewed many times on the national news. Dr. Slavin's on a daily call with Governor Baker. Dr. Walensky is on the state's reopening advisory board, and others are actively engaged as well. For me, I'm reassured knowing that our MGH leaders are front and center in helping to decide when and how restrictions should be lifted. Over the past couple of months, Mass General for Children has been shoring up the hospital as a whole. As some of you may have heard, in early April, our pediatric ICU transitioned to an adult ICU, and one of our inpatient pediatric floors became an adult floor to care for the incredible surge of patients being treated for COVID-19. At our peak, our hospital had about 165 patients in intensive care units and 387 in the hospital. As you can imagine, that was challenging. Our pediatric ICU specialists and many of our pediatric nurses, hospitalists, and residents started to take care of adults. It was inspiring to see them step up in that way out of their comfort zone, but willing and able to help the hospital manage the crisis. There's no question that having our PICU become an adult unit and having to send ventilators out of our NICU to support the adult ICUs was difficult. But it highlighted to us that really at Mass General Hospital for Children, we're just here to do our part. I really like the way Ron put it in an email to the staff, which was to say that our young patients now needed us to take care of their parents and their grandparents. And that's the ultimate example of family-centered care. And we're very proud of having been able to do that. Fortunately, a few weeks ago, as the number of critically ill COVID patients started to decline, we were able to begin resuming our normal pediatric inpatient care. With the support of the hospital, we could again accept pediatric patients into the PICU and restore full ventilator capacity in the NICU. From the surgical perspective, on March 15th, the governor directed hospitals to postpone elective operations. That's now over 2 months ago. And since that time, we've continued to do urgent and emergent operations. But the volume of deferred elective cases has been building up, and we're eager to get those cases done. That process will take a while, and hopefully it'll start within the next several weeks, although we wait for the governor to give us guidance. One challenge we'll have to confront is the fear that many parents still have of bringing their kids to the hospital, despite all our reassurances that it's very safe to come to MGH. There's no question that the weeks ahead and more will continue to test our strength, as we know now that there's nothing we can't overcome. The MGHfC family is stronger than ever. It's the best it's ever been. And really, these past couple of months have made me tremendously proud to be part of this team and what's really become a stronger than ever family. And with that, it's my pleasure to turn it over to Dr. Ron Kleinman.
Thank you very much, Allan. It's great to be with all of you this afternoon. And as Allan mentioned, this pandemic has really brought our family-centered care to a whole new level as we've actively supported Mass General to take on the care of adult patients who've tested positive for COVID-19. You know, for many of our providers, this is the first time in their professional lives that they're caring for adults, many of them since they were trainees. The teamwork, the support, the dedication to patient care has really just been incredible to watch. And although these are really challenging, scary, and stressful times, I have to say that the spirit of our team hasn't changed. We couldn't be prouder to lead this team, which has gone above and beyond to support the Mass General and our community in a great time of need. Now, having made the transition to caring for adult patients, we haven't lost our focus on family-centered care. We still recognize that what affects one member of a family unit has an effect on the entire family. So let me tell you about one family in particular that we cared for earlier this month. In a matter of days, an entire family found themselves in our care on Ellison 18, which is one of our inpatient pediatric floors. The adults were admitted having tested positive for COVID-19, and they weren't well enough to go home. And so with so many unknowns, we focused efforts on keeping everyone together. And by everyone, this particular family was grandparents, parents, and children. And throughout their time at the hospital, and with uncertainty of who could take care of the children if they were at home, the family's small children who had no symptoms but were COVID positive were given a room just down the hall from where we had hospitalized their parents, so that their parents knew that their children were safe and well cared for. And when I first saw what the nurses had done to support these children, I have to say that my eyes got teary. Our staff has gone so far above and beyond in their dedicated care for this family and all the families that we care for that it's really amazing. And in this particular case, they put 3 beds together in one room and decorated those beds to make them welcoming for little children. It was just amazingly touching and really allowed our staff to care for parents and children close by, and knowing that the grandparents were also close by, although they were on another unit in the hospital. So our focus on family-centered care has never held truer, and we want you to know, and trust that whenever a child needs us, we'll be here. So while Mass General Hospital for Children is staying strong for our community, we're asking our community to stay strong for us. And as you can imagine, funding for MGHfC will be critical this year, and now more than ever, given the current crisis. In the past, the Storybook Ball has raised funds for things like services that weren't reimbursable by insurance, and to help us develop programs within MGHfC. This year, we're changing the focus, and the funds will support the most immediate needs of our pediatric department, getting our outpatient clinical services back up and running, resuming our important research, and supporting our clinicians, our surgeons, our staff. So I'm going to end my comments by asking that you please consider giving what you can to support the ball this year, and please visit storybookball.org for more information on how to get in touch and support the event. And now I'd like to hand this off to Dr. Bryan Cummings for his comments. Thank you.
Great, thank you, Ron and Allan. So I'm Bryan Cummings. I'm the medical director for the Mass General Hospital for Children, and I'm a pediatric intensivist here as well. And I was asked to give an update about the situation of COVID-19 in the state and in the hospital, and give a little bit of perspective on where we are. And I know Dr. Goldstein had mentioned at our very peak, we had close to 400 COVID patients in the hospital, with about 165 of them in the ICU. If you look at the situation today, from the numbers this morning, there are about 1.5 million COVID-19 cases confirmed in the US, with about 88,000 or so of those in the state of Massachusetts. And Mass General has really been the leader as far as caring for the most patients with COVID-19 in the state. That has been just a tremendous amount of work that's been coordinated throughout the hospital. If you look at our numbers right now, we are way down from our peak, but we still have COVID-19 cases. We have 64 patients that are in our ICUs currently with COVID-19, but we also have a lot of other sick patients that don't have COVID-19 in our ICU. So we actually have 140 patients currently in the ICU, which is 9 above our normal licensed ICU bed capacity. So we are still using surge ICUs. And that is one of the requirements of the governor as we look to reopening to make sure that we have ICU bed space available. On our general care floors, we have 84 COVID patients that are confirmed, and those are now spread throughout the hospital. Early on in the pandemic, we had what we called dedicated COVID units, where we cohorted all the COVID patients together. And as we've become more comfortable and the amount of patients with COVID have dispersed, we now have these patients throughout the hospital. But we have been able to keep our patients safe and our staff safe. And haven't had a large outbreak of infections that have spread from our patients themselves or from our healthcare workers. Right now, we have 100 or so patients that are waiting for their test results to see if they have COVID. And that has been something that's been very, very consistent over the last number of weeks. And luckily, though, the amount of patients that we test has been going down. And you've seen that in the Massachusetts numbers that are released by the Department of Public Health, that testing actually has increased throughout the last 2 months, and the amount of people testing positive has gone down. And so that has been very reassuring and has allowed us, as Dr. Goldstein had mentioned, to shift back towards taking care of our normal patients in our care areas while we also manage COVID-19. And that has also led the governor to announce earlier this week that we can start to reopen many of our healthcare facilities as long as we meet certain requirements for having available inpatient beds in case this loosening of restrictions leads to more inpatient care needs. And this is something that's going to be monitored very closely. But right now, it looks like we will be moving into phase 1 of the governor's plan, and that will allow more visits to occur both in the outpatient setting and more inpatient admissions. And what that means for us in pediatrics is one of the priorities that the governor has placed for that reopening is pediatric care. In fact, we know pediatric care is essential right now. Because of the restrictions in ambulatory care, many children did not receive their vaccinations. And we want to make sure that we prevent secondary outbreaks of preventable disease. As you guys may recall, a year ago, people were worried about the measles outbreak in New York City. And now we've had thousands of children not get their measles vaccination. And so we want to make sure that the children do come back and that they know that it's safe to come back to Mass General Hospital for Children. And so we are prioritizing vaccination and routine well child care right now. And the third aspect that we want to make sure gets handled in this early phase is that the mental health of our children and our families is critical. And so we have many resources that are out there available both in the in-person setting and in the virtual setting that'll help get us through this very difficult and challenging but exciting transition phase as we think about what life might be like post-pandemic. So I'm going to end my comments there about the current state. I will just mention that we are seeing this pediatric manifestations of COVID disease that I can mention in the Q&A session. And that is something that is now taking over a lot of our pediatric inpatient care. But I'm going to switch it off to Bryan Rafanelli right now as one of our MGHfC's Advisory Board members. And then I'm going to come back to you in our question and answer session and talk a little bit more about that. So if I can pass it off to you, Bryan.
Thank you, Bryan. Thank you, Ron. Thank you, Allan, for doing such incredible work. I am honored to represent the Mass General Hospital for Children Advisory Board on this call. I can tell you we had a robust meeting this week of the committee, and the stories that were being told about what is happening at Mass General Hospital and Mass General Hospital for Children on our children's floors is just extraordinary and moving. I can tell you that I have been a volunteer for the Storybook Ball for 21 years, and I never imagined that I would be here 21 years later, much like you, never imagining that there would be quite a moment in time. I've lost 2 dear friends to COVID-19, along with having one of my team members in New York test positive for it. She's healthy, she's back to good health, but this has just really struck my family personally, and I am so grateful for the work that we're doing. Speaking of that, Fiona and Andrea have been doing incredible work. As you heard, we've raised over $250,000 so far. The dollars that are being raised, as Ron pointed out, are absolutely critical, and this is the moment in time that we really are asking everybody that's participating in this meeting today, and there's over 100 of you, which if you think about that, is pretty extraordinary. It's 25% of our total audience for Storybook Ball. So this is the natural moment for us to reach out to our friends, to our colleagues, to our families, to tell the story of Mass General, the great work everybody's doing there, so that we can actually raise the money. So I am asking you to please consider, if you're not on the committee right now, to please join the committee. If you are in a position to help us out financially, again, it's so critical to push us forward, to help fund the work that Ron and Allan need to do for the future of Mass General Hospital for Children, as well for the future of Storybook Ball. So again, on behalf of the Mass General Hospital for Children Advisory Board, we want to thank you for considering this. And we are hopeful to gather in the fall, by the way. That might be a question during the Q&A, but what does gathering look like? We're not sure. This is what it looks like today. But please understand how important the gathering of us coming together is going to be. We certainly are hopeful that we will be together at the Museum of Fine Arts in October. So I look forward to seeing you there. And again, thank you for your support. Thank you, Bryan.
Great, thank you, Bryan. And so I'm going to moderate a question and answer session here. And please submit any questions that you may have. And the first question that I'm just going to answer, because I probably am the right person to do it, but I can defer to Ron and Allan, is about this Kawasaki disease in children that has been called a number of different names, and you probably heard about it on the news. And so this disease called Pediatric Multi-System Inflammatory Syndrome, or PMIS, has also been named MISC, or Multi-System Inflammatory Syndrome in children. And this is a rare manifestation of, we think, related to COVID-19, but very similar to a disease we've seen before called Kawasaki Syndrome, or Kawasaki disease. And the reports of this have been coming from Europe and now from New York City in the previous weeks. And we were alerted to it by the CDC again about a week ago, but we had started to see our own cases here at Mass General Hospital for Children. And so this syndrome presents very similar to this Kawasaki's disease, with high fevers, a rash, and then you can have very characteristic types of swelling of the eyes, conjunctivitis, swollen hands and feet, cracked lips, and a strawberry tongue. And then many children actually present with GI symptoms. And so our colleagues in the UK and Italy and New York City have been publishing about this and informing the community. And it's been picked up by a lot of the news now, informing people to look for this. And it looks like this is happening about 30 days or 4 weeks after the peak of COVID infections in various countries. And so we think this is an immune reaction related to previous COVID infection. And while we haven't exactly proven that, that's what's been suspected. And so there are multiple studies going on around the country to try to determine the etiology of this and what treatments are effective. And so while you've heard a lot about this, it still remains a very rare phenomenon. And so I want to make sure we reassure the public that not all the kids that had COVID-19 infection or were exposed to COVID-19 are going to have this syndrome. And there are just reasons that people react this way that we don't quite understand yet, that have resulted in a few children being hospitalized for this. And the other good news about this is that most children seem to do well, and that there are a number of reports of people in the UK, for example, just being observed and this going away. And in the US, we've been observing patients. We've been treating them with a standard therapy for Kawasaki disease, or we've been using other more advanced immunosuppressives. And it looks like most children are responding to those treatments, so that's reassuring. We actually currently have 5 patients in our ICU with that syndrome. So it is clearly something that we see because we've had so many patients in our communities that have had COVID-19. And we've had a number of patients actually come in with it and actually leave already too. So it is definitely out there. And the next couple of weeks will really tell us more about how this is going to play out and how many children are affected. Right now, we really don't have the numbers. So that's what we know about the Kawasaki-related syndrome for COVID-19. Another question here is, can we discuss the psychological impacts of COVID-19 pandemic on children? And so we have a number of resources available on this topic. And so I might refer here to Ron and see if, Ron, you want to talk a little bit about what we have available at MGHfC.
Yeah, thanks, Brian. Obviously, the psychological impacts are not only on the children, but they're on parents, families, relatives, and so on. And it's hard to summarize all of that in a couple of sentences. But the fact is, children are social characters. They like being with other children. They're in school usually. They're learning with their peers. They're playing with them. And they have all kinds of informal interactions with both adults and children. And now all that's been turned upside down as families isolate, as schools are closed, as they have to learn virtually and learn to get along with each other all the time in a fairly closed environment. So we do have a number of support services, and one of the outstanding programs at Mass General Hospital for Children is our child psychiatry program. They are pioneers in many different therapies for both psychiatric and behavioral issues in childhood. And they've set up a whole set of different resources, from resources that are accessible through the media and resources that show parents how to work with their children around offerings on the media, to specific group chats where the children can really in some ways receive therapy for some of the issues that are arising. And we can provide links to those resources for all those who'd like to see them.
Great, thanks, Ron. So another question that came in is about resuming research, and both COVID and non-COVID related research, and what is our timeline for that, and what is it going to look like? And so maybe Allan, I can punt that to you to see if you have some insights on that.
Yeah, it's been sort of fascinating that around the world, research has come to a halt. I mean, my lab, we have collaborations in Israel and Hungary and all over the place. Everybody's just at home. It's been very frustrating for scientists. Fortunately, this week, at least in Massachusetts, and MGH has started an initial process, what they're calling their phase 1 of a several phase approach. The first phase here is that investigators, just 1 or 2 per lab, are allowed to come in and start ramping up to get ready to open. So that means getting cell lines ready, or getting animal models ready for research. We'll wait until we get guidance from the partner system to move on to the next phase, but that will involve, for the foreseeable future, making sure that limited numbers of people are in the lab or in certain rooms at a given time, that there's no communal space anymore, no eating lunch in the common conference room, and trying to work from home as much as possible. So our investigators, these are young postdoctoral fellows, and Mass General has a massive research enterprise with $1 billion of research funding. It's going to be incredibly challenging to do this in a way where some people will have to work shifts. Some will work in the morning, others in the afternoon. Maybe weekends will have to be on some people's schedule, and sort of an alternating strategy. Because unfortunately, while life for humans is with others, for the time being, it will be not with others. And so we have to figure out how to accommodate that and yet be productive in the research lab. Clinical research, I don't know where that stands. I believe that's still on hold in terms of recruiting patients and continuing all the many clinical research studies. COVID-specific research, at least on the basic science and clinical side, has been allowed to continue, obviously, with a lot of encouragement to do that. The NIH has funds specifically committed to COVID research. And if you were doing COVID research, you've been allowed into the lab to do that work. And there are a lot of investigators at Mass General for Children who have been actively engaged in COVID-related work.
Great, thanks, Allan. So another question that came across here is, how has telemedicine and virtual visits been integrated into MGHfC? And how do we see this moving forward? And so, Ron, I'm going to give that one to you.
Thanks, Brian. Virtual visits have transformed the care that we're providing since COVID began. And we are now providing, in some units, like psychiatry, 100% of the visits. In fact, in psychiatry as a whole, both adult and children, they're doing about 112% of the visits that they were doing before, because they found that they can do them efficiently. They can reach more patients that way, and it's proven to be a very effective way of relating to patients. In our medical specialties, It varies, but for some, it's 80 to 90% of the visits have been converted to virtual ones. And in other units where it really is important to bring the patient in to the hospital to be seen. And an example of that is food allergy, for example, or allergy by itself. They have been doing many fewer virtual visits and putting the skin testing and the food testing on hold. I know there was a question in the chat room about when we're going to resume allergy testing. And my expectation is that within the next month, we will have that up and running again. To come back to the question about virtual visits, we've embraced them. They are going to continue. We are taking advantage, good advantage of a bad crisis to learn how to better deliver care. And when we can deliver that care virtually so that a family doesn't have to come into the hospital, doesn't have to brave the traffic and find their way to a doctor's office, we're going to continue to do those visits virtually. We want to provide the most appropriate visit for each child. And if that's a virtual visit, then that's the way we're going to continue to do it. If it's an in-person visit, then we'll do it that way. So I'll leave it at that and stop there.
Great, thanks, Ron. So a couple of event-related questions came across, and so Bryan, maybe I'm going to ask these to you. And so, could you comment on the event in the fall? Is there a chance it could be virtual? And if it is, will we be able to invite guests in the same manner that we invite table guests? And any insights into how others are dealing with potential?
Sure. Thanks, Bryan, and thanks to whomever asked that question, because it's a great question. I think many of you have witnessed the virtual events that are happening right now. We have another one tonight, actually. So there is the potential that Storybook Ball could go virtual, and by the way, it can be, if you have not attended one, I highly recommend it. It can be incredibly dynamic. There's a lot of great storytelling we can do, and great connections that we can do as well. So yes, people can, if we do go virtual, we are going to have a program where we can preserve people sitting at a table of 10, which we know is both critical to you and your family and your friends, but at the same time, think about all the people that come to Storybook Ball that are a guest of yours. So we really do want to be able to take advantage of that. And of course, have the ability to let everybody contribute to MassGeneral Hospital for Children as they can. So that will be another dynamic part of the evening. So I can tell you that I could go on and on about, strangely enough, how exciting virtual events can be. And we all have a hunger to gather. So we are really running two tracks and thinking about this, of saying, what will it look like live? What will it look like? And how can we tell the story of MassGeneral Hospital for Children virtually?
Great, thanks, Bryan. And so another question here is the status of antibody test development at MGH. And this is especially important to parents with children returning to the school in the fall. And do we have any insights on that? Ron, do you want to maybe try to answer that a little bit, and I can elaborate?
Yeah, a lot of work has gone into developing antibody tests. The value of an antibody test is that it shows us who's had the infection. And potentially, if the antibody tests prove reliable, they can tell us who's immune to a new infection. So we're currently using antibody tests. They're both being studied, and at the same time, they're being used in clinical practice. We are just now rolling these out. So I can't tell you how effective they're going to be for us, but I anticipate that this is a major step forward in our ability to control this infection, to protect those who haven't yet been infected, and to reassure those who've been infected that they're immune. So more to come about antibody tests, but they're here, they're being used, and we're using them to their best advantage.
Great, thanks, Ron. And so there's another question here about what are our feelings about sending children to camp this summer? And so, this is a question definitely on personal risk assessment. And so, I don't know if I have the right answer for this. Allan, do you want to try to, what would your answer be for that?
Well, my answer is simple. My children need to leave my house. But beyond that, I am not the right person to talk about summer camp for kids.
Yeah, I think for most people, this decision has been made for you, and that a lot of summer camps have decided to close because they can't realistically maintain the social distancing that's required as we kind of have a phased reopening. But this is obviously going to vary state by state and what's allowed and as things phase in. So like many of you are waiting to hear kind of how things play out as we become less restricted in what we do. So I think the jury is still out on that. I think there's a question that actually is related to that is, what do we know about COVID being outdoors on playground equipment, pools, and the sunshine? I don't know if anyone on the panel has the answers for this one. I think we continue to learn a lot about COVID-19 and what its transmission is like. And so this is something that's constantly being studied. It does appear that the risk of you acquiring COVID-19 in the outdoors is low. From contact tracing in Asia, the amount of people that had been found to get the disease and from an outdoor encounter was very low versus much higher when you had close contact within a few feet of someone for greater than 15 minutes. And so while there's a lot of shaming going on of joggers across the street not wearing a mask, that probably is a very low risk thing for them to be breathing out into the air and having things dispersed. And so that is not really the risk that people have. It's really about being in very close proximity for prolonged periods of time. And that's how the infection is spread. But there's definitely new protocols being devised about how frequently we clean equipment to try to make it safe for people to be outdoors because we know exercise is important. And we know people do want to go out and see each other outside. So.
I will add that this has some special meaning, though, for those of you with us today who have little kids, toddlers in particular, because they don't observe the distancing rules that Bryan is talking about. They grab each other. You know this better than I do. They grab each other. They hug each other. They lick each other. They're interacting in a close and intimate way, and so if you want to prevent spread of COVID-19, you can't let little kids gather together that way. And while they may not get sick, their risk of becoming ill is very small. They can spread this to the family, and so you need to keep that in mind. And then now that we know about this pediatric multi-system disease, we know that a child can have COVID without any symptoms, and then a week or more later develop PMIS. And so there is further risk among that group. So I just wanted to add that in.
So one of the questions here is related to that about return to school. And I think you pretty much answered that, Ron. It's that we really don't know right now until it seems like there's less spread of the disease will schools be allowed to open. And definitely young kids, it's hard for them to so there's practical questions to answer. There's a question here I wanted to answer. It's like, what are we doing to keep children safe going back to their routine appointments? And so that is a critical question and one that the state has asked us to answer. It's part of our reopening plan is that we have to ensure the safety of our visitors. And so that is something we have to make sure happens. And so what does that entail? It entails making sure we have adequate personal protective equipment. And early in the pandemic, there was definitely shortages as everyone was trying to get their own supply. But now As we've gone 2 months in, we have a better idea of the amount of equipment we need, and we can manage it more proactively. And so we have the equipment we need to care for patients and make sure that we don't spread any infections to them and they don't spread any infections to us. The other issues are to make sure we have good infection control plans in place, which we follow the CDC's recommendations for that. And for people that we do know are infected, we have very strict protocols on where they can and can't go. And so we actually have specific areas in the outpatient setting of where people that have viral illnesses must be seen and people that have confirmed COVID must be seen. And so that way we're trying to make sure that everyone's protected, and then we can still have routine ambulatory appointments and make sure that the patients we need to get care for can get care without fear that they're going to get infected.
I would just maybe add, Brian, I agree with everything you said, and I want to reinforce how safe it really is. I mean, I've always told patients, because this comes up a lot, that it's probably safer, almost certainly safer to come to Mass General than to go shopping at Whole Foods right now. When you walk into the hospital, there's a symptom check for each individual, and you have to confirm that you're not having any of a number of symptoms. You then get your Purell on your hands, and you get handed a mask. So every individual in the hospital is wearing a mask at all times. In pediatric surgery, for instance, if you call to make an appointment, you'll be asked if the child or you have any symptoms. And if you do, you'll go to that separate clinic that Brian mentioned. If you don't, you'll come to our clinic. But in our clinic, the chairs have been positioned in a way that people will not be sitting near each other. And more importantly, you're unlikely to see other people in the waiting room because of the way that we're spacing visits. For us, we're trying to space visits wide enough that we can then do virtual visits in between, and thereby be efficient and at the same time ensure that you're not going to be really, there's no sort of crowding at all in the clinic area. So I really do think it's very safe, and it's so important for all of us to get that message out. The fact that so many children have gone without vaccinations is concerning. The fact that somehow, like a lot of people with serious illnesses somehow vanished over the last 2 months is really concerning, and everybody should feel comfortable going to the hospital.
Thanks, Alan. And so looking at the questions here, there was a question about what are the immediate funding needs of MGHfC? And so it was, maybe I'll ask both Ron and Alan to answer what their thoughts are on that topic.
I'm glad to start. This pandemic has really challenged everything that we do at the hospital, and you've heard through the answers to some of these questions what some of those challenges look like. But I'll just start with research. We have had 3 months now where all of our research, and Alan mentioned this before, all of our research has been shut down. So people who would be doing experiments now that would support applications for grants over the next 3 months haven't been able to do those experiments. We call that pilot work that supports grant applications. So we're going to need bridge funding for these individuals so that they have the funding necessary to conduct their research during this gap period between what was happening before and when they can again apply for grants and receive those grants. And to continue in research, we also mentioned that we have many projects related to COVID infections. Every aspect of COVID infections. And those grants, some of them will be supported by NIH funding, but many won't. And so we would like to be able to provide support for those projects that have direct relevance as we think about this infection and other infections like it going forward. Shifting off of research, teaching. We have a real opportunity here to increase the teaching that we do virtually. And we've gained a lot of experience using virtual teaching for our residents, our medical students, postgraduates over the past several months. We would like funding to be able to exploit what we've learned and turn it into new teaching programs, and to be able to support our physician teachers to be able to do that work going forward. When we think about the clinical care that we've been able to give, we have an opportunity here to really develop new models of care. And I've mentioned before that there are many children who require the services of many specialists: a surgeon, a kidney doctor, a neurologist, a geneticist, primary care physician. And up until recently, if a family wanted to get all of those services, they had to have separate appointments at separate times in separate places in the hospital, multiple trips to the throughout the hospital on different occasions. Virtual visits gives us the opportunity to have that family in one place and all of those specialists interacting with them to complete a multi-subspecialty visit. And funding will help us understand how to do that and initially support the time that people put in to understand how to best do that. That's just one example of how funding can support clinical care. And then one other, and we have a long list here, but we're coming close to the end. I have to again emphasize the amazing care that our providers gave to the patients who came into the hospital. And also acknowledge the stress that's put on all of the care providers at the hospital. Many of them there day after day dealing with life-threatening conditions, taking care of patients that they've never had to take care of before, worrying about whether they were going to bring these infections back to their families, and so on. And we need to support our employees and our care providers in particular. And there are many ways that we can do that, but all of those will require funding for that kind of support. So I'm going to stop there, and I really appreciate the opportunity to go through that short list.
Allan, do you want to add on anything to that?
Ron got it. I totally agree that the workforce issue, we talked about the mental health impact of this on children. The mental health impact of this crisis on our workforce, on doctors and nurses and all the support services is really, really significant. When, you know, in order to staff this massive number of ICUs, many of our staff were redeployed. So you would take for us, a nurse, a pediatric urology outpatient nurse, who one day later gets a phone call and is told, you're going to be a pediatric intensive care unit nurse taking care of adults with COVID. The emotional impact that this had on so many people, the fear, it was real, and it's going to have a lingering impact that I think we're yet to see how much it's going to affect those individuals. The hospital's been very supportive, but it's hard to walk into, for the first month especially, it was hard to walk into the room of COVID patients. It was an invisible enemy that we were really scared of. We've gotten better at it, more accustomed to it, for better or for worse. But I think this is really something to think about going forward.
Great, thank you, Allan, Ron, and Bryan. We're here at the end of our Q&A session, and so I'm gonna just kick it back to Ron for some closing remarks.
I'm going to be very brief. We, again, are very grateful to all of you for joining us this afternoon. It's been great to be able to come together in this way. Bryan Cummings, Allan and I want to thank both of you for joining us this afternoon, and to those from our development office who've put all this together. We really appreciate it. I'm sure that there are many additional questions that you have, and if that's the case, please feel free to email storybookball@partners.org, and we'll gather these questions and do our best to respond to them offline. So with that, I'm going to end the event and wish you all well. And look forward to seeing you all again in the fall at the event. in person or virtually, either way. Thank you.